Let's now discuss several stretches for the pectoralis minor or pec minor muscle. So in the picture right here in green, you can see the pectoralis minor muscle. Notice that this muscle originates off of the costochondral junctions of ribs 3, 4, and 5, and then the muscle converges up here to insert on the coracoid process of the scapula. Now this black line right here represents components of the brachial plexus, but also the axillary artery and vein. And you'll notice that those structures actually pass underneath the pec minor tendon. The reason I mention that is because when this muscle gets tight, it tends to restrict the space underneath the tendon where those structures pass. And so if there's less space, that leads to potential compression of those structures. And we see that in a lot of conditions, including thoracic outlet syndrome, or TOS. And so that's one condition where a pec minor stretch might also be very useful. This stretch also tends to be good for anybody that has cervical spine pain, thoracic spine pain, and then individuals who have that prolonged upper cross posturing where this muscle might become tight. Even in individuals who just have bad posturing, they can still get those upper extremity paresthesias because of the compression of those structures going underneath the pec minor tendon. So keep an eye out for those. Let's now look at a couple ways that you can stretch the pec minor. The first is what we call a doorway stretch. Now to do this, you technically don't need a full doorway, you just need a wall like this that you can brace your arm on. If you only have one wall like this, you would stretch one arm at a time, but if you have a full doorway, so you have another thing like this on the other side, you can potentially stretch both arms at the same time. I'm just going to show you one arm at a time. Now the pec minor stretch is done in standing, as you'll see right here. Basically what you're going to do is you're going to bring one or both of your arms where the shoulder's at 90 degrees of abduction. Again, you can see the elbows bent there. And I'm going to brace my forearm against the wall and really just lean into it. And by leaning into it, I'm giving my shoulder a little bit more horizontal abduction, or lateral extension as you might also call it. And this is going to give me a stretch right in this area right there where my mouse was. Okay? And that's where the tendons of pec major and pec minor are. So you'll see me switching sides there. Again, shoulder roughly 90 degrees of abduction, elbows bent, forearm braced against the wall, and then I'm really just leaning into it. Now, again, we get a stretch of the pec minor, but we can't isolate that completely. You're also going to get a little bit of stretch of the pec major tendon as well. So this is the doorway stretch for one arm. Again, if you had another one up on this side, so a full doorway, you'd be able to stretch both arms at the same time. But if you only have this, stretch one arm and then just switch positions to get the other side. In terms of the dosage, it's a stretch. So we're going to need to do this anywhere between 30 and 60 seconds. We need really at least 30 seconds to get any effect of it. But then beyond 60 seconds, we have that law of diminishing returns where we're really not getting any added benefit beyond that time. So 30 to 60 seconds is really that magic window. Now the form of the stretch I just showed you can be very intense for some people, in particular those with thoracic outlet syndrome. And there's really two main reasons for that. One, people with that condition and other similar ones tend to have weak scapular retractors, so the rhomboids, the middle traps, and so forth. And when they have weak retractors, that scapula is already in a little bit of protraction, and protraction tends to limit that space under the pec minor tendon for the brachial plexus and other structures to move to the upper extremity. Also, as we mentioned, when the pec minor is tight, that intrinsically decreases that same space. And so a lot of times when people lift their arm up into 90 degrees of abduction like that, they'll get those upper extremity paresthesias and they won't like it. So here's an alternative to that. This is really the same thing, except instead of having the arm at 90 degrees abduction, we're going to keep it a lot lower like you see here. Okay? And there's no real rule of how low you can have it. It's really just patient tolerance. But that's clearly lower than it was in the previous slide. And so maybe this is enough to get a little stretch, but not enough to elicit those paresthesias in the arm. And so this can be more tolerable for a lot of people. The thing to know about this form of the stretch is because you don't have the arm as high up, it is going to be limited in how much it's going to stretch the pec minor tendon. You'll get some, but you won't get as much as you did in the previous technique, which is more intense. But this is one option. Now, if you're really concerned about those paresthesias but still want a decently intense stretch, then consider the next stretch for the pec minor tendon. So here's another way that you can get a pec minor stretch using a half foam roll. Obviously, my head would be up there by the pillows, and then the half foam roll really lies on the midline of the table, as you can see right there. Now, obviously, a full foam roll is going to be very difficult to do this with because that's just going to roll all over the table. So for that reason, the half foam roll is better. It has a flat surface that'll stay static on the table. The other thing about the half foam roll is it's half the height. And so the full foam roll, even if you manage to get it still, it would probably be a little bit too intense and because it sticks up a little bit too high. The half foam roll is a perfect height to really get the appropriate stretch of the pec minors. So here's how you do it. So patient position, it's going to be supine with the half foam roll on the midline of the spine like you see right here. So it might take a second just to get adjusted on it to the right position. But then basically you're just going to lie on your back like this, head on the pillow, and you're going to lie with your shoulders abducted to about 90 degrees or a little bit less like you see right here. Elbows can be bent, and you're basically just allowing gravity to horizontally abduct your shoulders or laterally extend your shoulders. And this is going to give a stretch right around there where you have the pec minor tendon that goes up to the coracoid process of the scapula. It's also going to get a stretch of the pec major as well, although it's not going to be a super intense stretch of the pec major. It's really going to be more of that pec minor. And the benefit of doing the half foam roll technique like this is if a patient has weak shoulder muscles and can't really hold their arms up to do the pec minor stretch at the doorway, this is a good alternative to that because they don't obviously have to lift their arms up. The other thing about the doorway stretch is for some people with those paresthesias, it might be a little bit too intense. This one is less intense, but it still gets that pec minor stretch pretty good. And it's also a much more relaxing technique because you get to lay on your back rather than having to stand up and find a doorway. The obvious disadvantage is you have to have a half foam roll. In terms of the dosage of this stretch, again, it's a stretch, so you want to do it anywhere between 30 and 60 seconds. Really at least 30 seconds to get any benefit of it, but again, beyond 60, we have that law of diminishing returns where you're not really going to get any added benefit beyond a minute.